Hey, today I wanted to talk to you about contraindications, prescription meds with ketamine-assisted therapy and psychedelic-assisted therapy, for that matter, too. There's, this huge wave of big pharma and pushes these mood stabilizers and benzodiazepines on depressed patients, so it doesn't allow them to feel depressed. And so the benzodiazepines, namely, are Xanax and clonazepam, and the mood stabilizers, Lamictal, and new one out there is Vraylar. They do their job in the fact that they don't allow you to feel. It's a numbing medication, causes some brain fog, but you're not feeling bad, so I guess it must be working. But when you take those medications in conjunction with psychedelic-assisted therapy and ketamine-assisted therapy, it interrupts what the whole therapy is meant to do, what the whole journey experience is meant to happen. Journey experiences can be very high and blissful, and they can be very low and uncomfortable, sticky, and dark. I will never say there is such thing as a bad trip when it's in a proper set and setting. It's just the experience that you're meant to have and something to be curious about when you go to integrate. So I got a little chart back here, and I want to talk to you about what happens when people are taking benzodiazepines, okay? And so what I got here is a happy and a sad scale, okay? And then down the middle is this neutral territory. And this wavy line is the human experience, okay? And to fully experience what the human experience is the highs and lows, okay? So you can't always be high and you can't always be low. Life does happen. Some people stay low. I realize that. But for this purpose, highs and lows, okay? You can't have one without the other, okay? You can't experience huge blissful moments if you never experience any discomfort, sad moments. It's just not the way it is. So when people are prescribed these medications, numbingness occurs, and so they travel right here, right down the middle. Okay, they're not experiencing lows, so I guess that's good, but they don't get an experience up here either, and that's joy. Okay, and joy is where it's at, people. If you can't experience joy, you're not experiencing the human experience. But you can't have joy without feeling some pain and some discomfort. Okay, so yes, when you take these medications, they keep you right here. And so what happens when we put somebody through a ketamine journey or mushroom journey or whatever that is on those other places, right? Those patients that are on those medications are not able to feel what they should feel, the highs and the lows, okay? And therefore, it just negates the whole process, because if you can't feel the sticky, dark situations, then there's no growth for you to have. And if you can't feel blissful moments, then you know that, so then you miss out on the joy. It's plain and simple. So if you or loved ones are taking these medications and attempting to do psychedelic therapy or ketamine-assisted therapy, and it's not going very well, this is why. You have to get off these medications. You have to minimize them. You have to take vacations from them in order to feel the human experience, in order to feel a ketamine journey, which in some ways is like a human experience condensed into a 1-hour journey session. So that's all for now. Have a great day. Thanks for tuning in.